This is my video for intramuscular injection. The first thing I'm going to do is I'm going to check the original order with the MAR, know that my patient needs medication at this time. I'm also going to know the medications of the drug. I'm going to know any special nursing considerations of the drug, any adverse effects of the drug, and if there's any allergies. And that'll also be in the patient chart. Once I know these things, I am also going to go and prepare the drug. I'm going to go to the drug cart, perform hand hygiene. I'm going to do appropriate drug calculations, make sure it's in the safe dose range, and make sure I know what I'm doing. So then I'm going to take the MAR, and the first thing I'm going to do is I'm going to find the drug, drug X for today. I'm going to take it out of unlock the drug cart. I'm going to check the drug, make sure the expiration date is okay, and I'm also going to double check it against the MAR, make sure it's the right drug, which is the first check. I'm also going to prepare one patient's drug per time. This patient only needs one drug administered at this time. So then I'm going to, I know it's an intramuscular injection, so I'm going to get my 3mm needle, or syringe. I've selected a 23 gauge 1-inch needle. I'm going to attach that. Okay. Second thing I'm going to do is I'm going to alcohol wipe, sterilize the top of it, and then I'm going to withdraw the medication. So that's my second check, is make sure it's the right medication. I'm going to check and make sure it's the right one, and I know that I need a 0.5 milliliter of this medication. So I'm going to, only touching the bottom, I'm going to withdraw the air. I'm then going to cap it, insert it in there. I'm going to inject the air into it, then flip it over. And only touching the bottom of it, I'm going to withdraw my medication to the desired amount. Okay. I'll withdraw a little bit extra just in case there's air. I'm going to withdraw that. I'm then going to make sure I get the right amount. Make sure there's no air, no bubbles in there. Okay. And there we go. We have the right one. So then I'm going to do the scoop technique. Make sure I have the right amount of medication. And then one of the third checks is making sure that it's the right medication that I have withdrawn for the patient at the right time. I've checked that, and I'm going to put my medication away. So now I have the appropriate medication, and now I know it's the right time. I'm then going to go to my patient room, which I know that they're there. I'm going to knock on the door once I gain entry, never leaving my medication out of sight. I'm going to introduce myself as a student nurse from Madison College. I'm then going to ID my patient using two markers. They have a wrist bracelet. There you are. Can you tell me your full name and date of birth? Okay. I would then describe what I'm going to be doing to the patient, which is an intramuscular injection, which is part of the 5 rights. So I have the right patient. I check my MAR. It's the right time, the right route, intramuscular, right dosage. I perform my medication, and right patient amount, drug dosage, and time. So then I'm going to check my patient. I did hand hygiene. I'm going to provide some privacy for the patient, and then I'm going to describe to the patient the appropriateness of the medication, make sure they know any adverse effects, any kind of special nursing considerations I need to do for this patient, and that's okay with them. They are compliant. So then I want to raise the bed up a little bit, make sure it's on the right height, over the side rail. I'm going to grab some gloves. Never turning my back on the medication. I know exactly where it is. Put gloves on. And then move my medication closer. I'm going to do site finding. So I know I find the acromion process over here, which is then 2 fingers down. I'm going to kind of mark that. I'm going to get out my alcohol swab. I would then swab from the very center, circular going out, and then I would do my medication with a darting-like motion inside and inject it. So for the purpose of this video, I have one of these. The Z tracking, what I would do is undo that. This has already been alcohol swabbed. I would displace the skin by 1 inch, over like that. Use a darting-like motion, stab, secure, then slowly introduce the medication in there. Wait 10 seconds before withdrawing it. It's about 10. And then I would remove. Put this immediately in the sharps container, but I need this for later. And then I would take my gauze and I would apply light pressure on there. Just make sure that it's okay. I would then check my patient and make sure they are okay. Take off gloves. Dispose. Hand hygiene. Do that. And then I would document that the medication has been administered against my MAR. Make sure I did that to the right time. I would then see if there's any other thing the patient would need or required, and make sure they are okay with their medication. I would also come back later and see the effects of the medication and see if they have the desired effects and if there's any other kind of outcomes that they would need. I would do that later, but for now I would make sure the patient is comfortable. Okay, the side rails will be up, in the bed in the lowest possible position. Make sure they're okay. She has her call light near, and then I would do one last hand hygiene for fun and document everything and leave, and that's it.